Common Ground has an amazing ability to bring together partners from diverse areas of work and find common ground, to find that which is necessary to transform health in the ways that will best serve our community.
I've been involved in many boards. My longest association, other than with my own board, has been with Common Ground Health. And to be involved with an organization that's serious about improving population health through collaboration, data, evidence, best practices, and then seeing some of the results is something that can keep you involved.
I'm Marty Teller, the Executive Director of the Finger Lakes Addictions Counseling and Referral Agency, FLACRA.
I am James Norman, CEO of Action for a Better Community. I am very impressed by the level of individuals Common Ground is able to attract to its decision-making tables. So that, in a way, tells me that you're in the right place because you're sitting here with people who make decisions that have broad community impact.
To be able to have Jason Helgerson, the Director of Medicaid, come to the smallest table and to have the dialogue and be able to provide the input, because at that time Jason was asking, what do we need to do to transform health care in New York State? Common Ground's ability to influence legislators, recognize the importance of the issues, and bring them to help in that solution has been fantastic.
Data is very important, and that's one of the areas in which Common Ground excels, to show the incidence of various chronic conditions, acute conditions, as they impact different population groups. Common Ground Health has been able to collect and analyze that kind of data to address some of the disparities that exist.
Our area specifically is the only performing provider system in all of New York State that took on the project of transitional housing. If a person doesn't have a roof over their head and stable housing, it's pretty hard for them to pay attention to their health and well-being. And this really comes as a result of the community needs assessment that Common Ground Health brought to DSRIP.
One thing that my awareness was raised about how much environment and behavior contributes to health status. So that led to more activity occurring in neighborhoods, in community centers, in churches. We also have various initiatives going on in barbershops. 20 years ago, who was going to barbershops talking about health? Well, right now, I'm excited about the greatest new effort, which is the Workforce Development Consortium, where we are trying to recruit and train and place people into healthcare careers.
Optimism is a deep emotional phenomenon, and with the data work that Common Ground Health does, we can truly bring that deep emotional commitment and then influence others to recognize those facts and make the change necessary for the health of our communities.
Collective impact requires that you have a backbone organization. Common Ground Health is the backbone organization for the collective health initiatives in this community to improve population health, because it provides the professional expertise, it provides the support to the work groups, it goes out and raises money, it does all the things that a collective impact backbone organization has to do.
The commitment of the individuals around the table to do something together, to do something good, has obviously a multiplicative value for the individuals that we care about.
And of course, you don't necessarily solve all the problems through one initiative, but when you make significant progress on an initiative, that gives you a good feeling, because you're there to make a difference.